Indigenous people resisted and persevered, even as centuries of European colonization created social and material conditions, such as war, displacement, and famine, that left their nations vulnerable to epidemic disease and death. San Antonio was the first city in Texas to inoculate against smallpox. In 1806, by order of the King of Spain, orphan children infected with smallpox were sent to San Antonio to inoculate children in the community. By 1830, immunizations became mandatory for all children in San Antonio. In 1849, a cholera outbreak caused widespread panic in San Antonio. City Council responded by creating San Antonio's first Board of Health. During a cholera epidemic in 1866, 3 French sisters from Incarnate Word created the city's first hospital, the Santa Rosa Infirmary. To prevent cholera, which thrives in stagnant water, the Board of Health recommended paving streets and improving drainage. By 1894, sewage lines channeled waste to San Antonio's west side, worsening health problems in this long-neglected neighborhood. Through most of the 20th century, San Antonio battled infectious diseases. In the early 1900s, San Antonio was home to the nation's third-largest red light district. San Antonio did not close the district until the 1940s, when the U.S. military threatened to bar troops from visiting downtown San Antonio. Based on the erroneous belief that insects transmit poliovirus, San Antonio sprayed the entire city with the pesticide DDT in 1946. With desegregation in the 1950s, African Americans gained better access to public spaces that affect health, such as public transportation and parks. Medical advances and a new public insurance program called Medicaid helped San Antonio achieve historic lows in infant mortality during the 1960s. In the 1970s, after several West Side children drowned during a rainstorm, communities organized for public service, or COPS, waged a successful campaign to improve drainage, streets, and sidewalks in that community. In 2000, San Antonio became the last large U.S. city to fluoridate its water. Voters narrowly approved it by a 53% majority. Chronic diseases such as heart disease and diabetes replaced infections as the leading causes of death. In 2003, the Centers for Disease Control and Prevention named San Antonio the most obese city in the nation. In 2018, recognizing the devastating health impact of tobacco, the San Antonio Metropolitan Health District and its partners successfully fought to raise the city's legal age to buy tobacco from 18 to 21. There have been many public health challenges throughout San Antonio's history. However, none could have adequately prepared us for the impact of COVID-19 on our community and our public health system. On January 29, 2020, the city of San Antonio issued its first official release on the novel coronavirus. By February 13, 2020, the city reported its first confirmed case of COVID-19 in Bexar County. At that time, there were 15 confirmed positive cases in the United States. On March 2, 2020, Mayor Ron Nirenberg declared a local state of disaster and a public health emergency due to COVID-19 concerns. 9 days later, the World Health Organization declared COVID-19 a global pandemic. The city of San Antonio's COVID-19 response has been strong since the pandemic's onset. In 2022, Metro Health improved vaccine access for vulnerable populations by hosting over 200 pop-up vaccination clinics in areas most impacted by the COVID-19 virus. On Friday, March 25th, 2022, after 15 months of continuous operations and more than 226,700 COVID-19 vaccine doses administered, the Alamo Dome mass vaccination site ceased operations. As of March 2023, the San Antonio Metro Health District and local partners have fully vaccinated 74% of San Antonio and Bexar County's eligible population, a rate higher than the state and national averages. As the city's community health strategist, Metro Health is committed to eliminating historically rooted social and racial disparities in health through innovative practices and partnerships, to building a robust and resilient public health workforce, and to making our public health more responsive to communities as they confront future health threats.